Okay, now I'll be doing my abdominal assessment. I am going to start by making sure my patient is as comfortable as possible. I can place a pillow below his head, maybe under the knees. In this video, I will not be actually applying hard pressure and things like that because he's super sensitive and very ticklish, so I don't want to mess up the concentration. So I'll mock it as best as I can. I would start by explaining to my patient what I'm doing, and I would warm my hands and stethoscope as best possible. I would ask about pain. If the patient was emphasizing pain, I would focus on that area, have the patient point to the area of pain because that helps us identify better where the pain would be located. I would stand at the right side. I know it's kind of weird in the video. I'm doing the best that I can. So I'll begin my assessment again, much like other systems, by inspecting first. Then I will listen. Then I will percuss. Then I will palpate. And again, the reason for that is so that we don't alter bowel sounds and things like that by touching or percussing first. So I'll inspect for any kind of abnormal pulsating, any kind of mass, any kind of distension of the bladder, or appearances of abnormalities in general. Symmetry, I'll check. We'll also drape the patients appropriately. And then I will go ahead and listen. I will listen to all 4 quadrants. And then Now I'm going to listen over the aorta. And the renal arteries a little to the side. And then the iliac, right and left. And then femoral would be in there, under. We know that 5 to 34 bowel sounds a minute are normal. And then I will percuss all 4 quadrants. And I will perform, then we know that there should be tympany over air-filled space, dull if it's solid like over the liver. And then I will perform a deep palpation, but like I said, he's very ticklish. In all 4 quadrants. If he was complaining of pain that appeared as appendicitis, I could look at McBurney's point, which would be right about here. And then I'm going to palpate the liver. So I would put my hand underneath him. I would ask him to take a deep breath, and upon inspiration, I would try to fill. So that's that. And then the same thing on the other side with the opposite for the spleen. And then for the kidney. And whenever he is at the max point of inspiration, that's when I'll try to see if I can fill the kidney. And then again, upon that, you're going to go look for tenderness, pain, any kind of scarring that will give you insight to their history or things that maybe were not disclosed. Then I will I will also look and palpate for the bladder. I'll feel the pulsating of the aorta. Check for ascites. If there's ascites, we could do the fluid wave where we have somebody apply pressure and check for the shifting of the fluid. In addition to that, I can have him sit up. Can you sit up for me? And then now I can check for the CVA tenderness right about in here. So yeah, right about here, I can check for the CVA tenderness. And that should conclude my abdominal assessment. Thank you.